Hi guys, thanks for tuning in to the Exercise Physiology Brisbane YouTube channel. Today we're going to be looking at pelvic control with the interaction of transverse abdominis and multifidus control. So it's a very specific movement, and I'll just get into position and I'll talk you through it. So just placing the ball through L5 down to the sacrum, so making sure the pelvis is off the ground. So obviously the ball is creating unstable surface. So what we want to do from here is engaging TAs. Okay. Then we're going to tilt the pelvis forward, just about 1 to 2 centimetres. That has to be a very small movement, and then back to the neutral spine. So you're getting into an anteriorly tilted position with the pelvis as you're tilting forward, obviously, and then coming back to a neutral spine or slightly posteriorly tilted. So as you're going through that posterior tilt, you want to feel erector spinae multifidus contracting to get you into that position. Then from here, we then control back to that neutral spine. So that's the most challenging part, is that eccentric control back into position. Okay, so I'll just go through the movement again. So this is your starting position, tilting the pelvis forward, then back to neutral. So you should feel like the actual pelvis is orientating itself rather than having the whole lumbar and thoracic spine tilting. So what I mean by that is, as we're tilting the pelvis, we don't want to see this. Okay, we rather just want to see the pelvis moving itself and then back into position. Okay, making sure TAs is working throughout the movement to facilitate that control with the pelvis. Back into position. So that movement there, we're going to use a fair bit in the clinic just to have a look at patients with lower back pain and how we're actually looking at that lumbopelvic stability and the interaction of TAs and multifidus. So you try and avoid that with people with acute lower back pain, but obviously chronic lower back pain, it's a good tool to use to have a look at that movement and that control they have. So people with lower back pain, we know that multifidus TA activation is going to be decrease in activation capacity, but also the onset of the activation pattern is obviously not as great as it could be. So thanks for tuning in, guys, and I'll talk to you next time.